Hey guys, welcome to week 5 of my weigh-in.
And that is the sound my brain made while editing this video. Hi guys, how are you doing today? My name is Kidneyjay. The J stands for jerk because my kidneys are a pair of jerks. And this is an Amberlynn Reid video. So this one is called Bariatric Weight Loss Surgery Patient! Weigh-in week 5. So last week she went to her weight loss weight loss surgery information session, we'll call it. And she didn't say much about it, but she does talk about it in this video. I do cut it down considerably because it is an Amber Rambler. I cut it about half. And she answers 5 Instagram questions about her weight loss surgery. Now, if the questions are about Bujos or Legos, I skip it. But these questions were actually something I was interested in, so I left most of them in. You guys know the drill. Leave a comment down below if you've had weight loss surgery. If you have any information to add, I appreciate it. I like learning from you guys as well. Leave a like and subscribe if you're new, and let's get into it.
For part of my weigh-in today, we're going to talk about the goals because I am now a bariatric weight loss surgery patient. I am trying to get weight loss surgery, so if you're new to my channel, that is a goal that I have for this year. So let's get into it.
So if you're new to her channel, oui, français, talking to you guys, just know that this enthusiasm, this hype that she's showing now is cyclical. This is nothing new. It's happened with Weight Watchers. It's happened with Octavia, whatever that weight loss plan was. It happened with keto. It's happened with weight loss surgery in the past before. She's really hyped. And let me just point out that this part of her cycle, she's not blaming us yet because she's hyped. She's ready to go. So the audience is not yet blamed.
The first question is, are you using the stationary foot cycle Feline got you for Christmas in 2021? So I was using it, but as you guys know, I tore ligaments in my ankle and I was not able to use it then, obviously. And now as my ankle is healing and doing its thing and getting its SHIT together, when I straighten my ankle, it kind of hurts. So I am not currently able to use it. No, but I am keeping it for when that pain lessens because it has actually gotten a lot better in that regard. Next.
Okay, so we're back to the dangling ankle, which happened, 6 months ago? It happened a while ago. Listen, if it's painful for her to do her little stationary, foot bike that Feline got her, that's fine. But my question is, has she followed up with a doctor? Has she done any exercises that sort of help strengthen the ligaments around her ankle so she can do exercises? These are all questions for me that I have for her. Because if she hasn't done any of that, then it kind of just sounds like an excuse.
Question is, what's your BMI highest and what is it now? At my highest, I was 572.4 and my BMI was 104.8. Wow, that's horrible. And now it's 91.2, which is still horrible, but it's gone down 13.6.
Okay, so what she doesn't share is, and if you don't know, I'm going to put it up on the screen here, BMI, body mass index. So you have your normal range, you have your underweight range, you have your overweight, and then you have obese. And then also they have super morbidly obese. So she is way off the chart. She's basically unclassified as far as body mass index goes.
So I don't really agree with the whole BMI thing. I know that's a hot topic, but it's you can't judge someone based on a BMI, a normal sized person, because you could be 150 pounds with tons of muscle, or you can be 150 pounds with tons of fat on your body. And there could be two individuals, both 150 pounds, both, 5'5", and their BMI comes out the same, but one of them has more fat, one of them has more muscle. So, but at this size, it's obvious this is not 500 pounds of muscles.
Okay, so I actually agree with her somewhat about this and the BMI and how it's not exactly like you have to be right on that to be considered healthy. Someone I know was doing Weight Watchers, and they set a target weight for you, and the target weight they set for you is actually within the BMI, and there is no way that this person, like, very the build she is muscular, so the BMI that would be showing her still overweight, she would still be considered healthy. And what Weight Watchers want her to do was actually go to her doctor, and it's not there's other things other than just muscle and fat. Blood work is done, everything else is done, and basically the doctor said, yes, you're healthy at this weight, this is your ideal weight, even though it is not within the BMI parameters. Now, why Amberlynn is even talking about that, I have no idea, because right now for her, BMI matters 100%. Like, and I think maybe she's dreaming, I don't know, trying to think into existence of actually being able to have those numbers be taken into consideration. Because right now she's, like I said, off the charts, and she knows that too.
Question is, what's the next step for weight loss surgery? So the next step for weight loss surgery is a lot. The next few things I will be doing is I have a scheduled doctor's appointment, because you have to get a letter. It's like a letter from your doctor saying, yes, I want my patient to get weight loss surgery. I think it would be good for them. So they have to write a letter to the weight loss surgeon and fax it over.
Can I just say, I also think that so the weight loss clinic knows that she has a primary care provider as well.
Get my labs done, which I have all this scheduled. My doctor has to go over my labs, and then if there's anything that stands out that is not very good, then she has to relay that information over to the surgeon. And I also have an appointment to get my GI scanned. So it's just a scan of my GI where I have to drink this stuff, and then they do several pictures of my chest.
So I guess she's talking about an upper GI series where they basically take an x-ray of your esophagus, stomach, and your small intestine, and you drink this stuff. I know I've had it before, and I had to drink barium. I think now you can drink if you're lucky, you could drink a water-soluble contrast, which is basically, it's like drinking water with a kind of little funny off taste. And they just make sure everything moves well, everything is good, nothing stands out. So there's that chest to get done, I guess.
Have to take a course, and then I just have a few little things, they want me to lose 1 pound. 1 pound! I swear to you, me and Feline were shocked, because it's you see this way on 600 Pound Life where it's so extreme. It's I want you to lose 30 pounds in a month. It's not realistic. And this program is that's not realistic. If you could do that, you would have already done that. They just want you to improve your weight and who you are now. That's eating habits, drinking habits, exercise, movements, etc. Next question is, what part of your body...
I guess what I have to say about that and her 1 pound loss, she's kind of a little cocky about that, considering we've seen her gain 10 pounds in a week. So that 1 pound, she talks about a lot how she wants to exceed these recommendations that they're throwing at her, which I think is silly. She is, again, trying to do too much and is setting herself up for failure.
Are you most excited to improve with weight loss? And it's simple, my heart. and my lungs and my liver and my kidneys. I want to improve my insides, my organs, the part of my body that makes me function as a human. My brain, like, do I have fat on my brain? Probably.
So just so you do know, because I was doing some reading, I think this was from the Mayo Clinic, that being obese can actually substantially raise your risk of dementia, which is something I never thought of. But she's talking about her other risks for her heart, her kidneys, as well. She doesn't mention this, but cancer risk. She has had cancer before, and we're not going to get into did she, didn't she, whatever. She said she had it. So obviously that a higher risk of cancer.
Choosing to save my life. Like, this is what's going to save my life, is losing weight. That is what is going to save my life. And for the last year, it's like I've been fighting back and forth with, like, okay, should I follow instructions with the outpatient, or should I do it my way, or blah, blah, blah. It's been so confusing, and you guys have seen that. Okay, so now on to, like, my weight and stuff. So last week I weighed 520.0, and this week I weighed 515.0. So that means I'm down 5 pounds.
Yay! Congrats on your 5-pound weight loss. We'll celebrate that victory. We will cautiously be optimistic because, like I said, I think she's going way too fast here. But yay, good, down 5 pounds. We'll see what next week is and the following week is, because we all know this is a long-term lifestyle change, not just, okay, I lost 5 pounds this week, then I'm done.
Which makes me really freaking happy. So at the current stage for me, they want me to eat less takeout, and they want me to eat several times a day, because they taught a lot about, like, how your stomach, like, when you get super hungry, it starts to, like, shrink, and it sends off a lot of hormones. And for someone who eats a lot, those hormones can make you overeat, and that's why people overeat, because they just don't eat as much and as often as they should. So they taught, like, you know, eat protein first, have, you know, a lot of protein with fiber. And what I love is, like, they're like, don't be afraid of fruit. What they consider healthy is, like, whole wheat, whole grain, and things like that. And the fact that they only want me to lose 1 pound right now is it makes me feel good, but I do have my own goals.
Okay, so let's just say I'm looking forward to that whole wheat, whole grain fruit grocery haul, Amberlynn.
I do not want to have surgery in the 500s. So I'm not getting surgery anytime soon. My goal is to have it this year, though, but it's not like, oh, in a couple weeks. That would be nice, but that's not realistic. I want to be in the 400s. Like, I want to be out of the 500s. I could be 498. I mean, that's a little, but I do want to lose more than 1 pound, obviously. So they do.
So I have a question. Let's just say she gets to 510 pounds. It's been 6 months. I know she's 515 now, but let's just say in Amber fashion, she's yo-yoed between, 115, 125, 525, 520, 518, and she finally gets down to 510. And they say, listen, let's do this. It's time. You're ready. Let's do weight loss surgery. Is her excuse going to be, no, because I want to get weight loss surgery in the 400s, and then we're just like this, stuck in a cycle forever and ever? I don't know. Maybe.
Want you to slowly stop drinking carbonation. So I actually saw the dietitian when I am allowed to have 2 diet sodas a day. I used to have 4. And as for, like, exercise, they want me to exercise like 2 to 3 times a week. So I set myself up a little exercise program that I'm going to be doing. It's just, like, super simple, starting off slow.
Okay, so I would love to see the exercise vlog. Love to see it, because I want to know what exercise she's doing. And this is in all, like, sincerity. I want to know which exercises she's doing with that ankle if she can't even go on a stationary bike. Because I would assume at her weight, even just standing and walking would be hard on her ankle. Now, I also do have to add that she mentions quickly at the end, oh yeah, and also another thing I have to do is my psych eval. Now, those of you who know, she tried weight loss surgery before, and that's where the brakes went on, and they said, listen, you need to heal your past issues before we go further. So she doesn't really talk much about that. I'm interested to see what the outcome of that is. But anyways, I know this was a long one. I tried to cut it down as much as possible. I appreciate all your ears and eyes, and we'll see how this goes. I'll see you later. Bye.